Hi, everyone. This is Sean with the MassSupport Network here with the Massachusetts Weekly Public Health Report for Friday, April 30th, 2021. Things are trending downwards across the Commonwealth with almost 5,000 fewer estimated active cases right now. When we look at people who are under monitoring or quarantining, last week there were over 11,000 awaiting test results or following exposures. Now there's just over 9,000, drop of over 2,000 fewer people, trending downwards there as well. In terms of isolations, these are people who are in isolation due to confirmed COVID-19 diagnoses. We had just over 32,000 last week and just over 27,000 this week. So continually dropping there. Still a large number of people infected, but significantly fewer week by week. The average ages of cases, hospitalizations and deaths stay mostly the same. The average age of deaths came down 1 year. The average age of a new case remains 33. Looking at our hospitals, things are still trending downwards. Not a whole lot, but still going in the right direction. Intubations and ICU admissions are going to move a little bit more slowly than hospitalizations, as there's going to be more serious cases that require longer terms of care. But each fewer case is one more spot if someone else needs it. So it's good to have these resources available as cases continue to trend downwards. Testing turnaround time remains more or less the same, maybe a few minutes longer, but nothing that is worth really discussing there. Still less than 30 hours on average between tests being sampled and being reported to the Department of Public Health. So looking at the state and our incidence rate across all the counties, last week, the average daily incidence rate, the number of new cases per 100,000 people per day, was 24.7. So we've dropped almost 5 cases since then. It's great. Every county has been trending downwards. Some more than others. Barnstable came down a bit more than others. It's still coming down from its recent spike. Dukes and Nantucket are still fairly high, but again, those are very small population counties. So those are going to have fewer cases are going to show up higher on this. But most of the state is trending up pretty lower. Hampden County is going slower than others, unfortunately, as a lot of even the bigger urban counties are trending downwards much faster. When we look at this incidence rate over time, going back to the end of 2020, it's kind of interesting how you can see, looking at Eastern Mass, back at the beginning of the year, there was a bit of separation between the counties, although things are following the same general arc. And now they've all kind of tightened up to be in the same fairly narrow band. With, of course, you can see the Barnstable cluster there, from that cluster in the Cape, and then come up here in yellow is the islands and how they've been doing, which of course they're always going to be higher and lower than you might otherwise be, just because of their small population. So there's been kind of this tighter cluster. Everything's moving more or less the same direction here. When we look at Western Mass, it's a slightly different story because there's more space between these. Trends have been a little bit different. Franklin County has been consistently one of the lowest, as the least populous mainland county. It's gotten much fewer cases. And we can see here, for example, the Hampshire County UMass outbreak from this past winter, and where Hampden County continues to be the highest in the area, where the others have broken away down from it. And looking at the percent positivity, this continues to trend downwards, dropping by a bit. Again, that's the bottom line is the screening testing done at colleges and universities. The blue line, the dark blue, is the percent of tests coming back across the state, and the gray line is the percent of tests coming back when we discount the higher education testing, which tends to trend lower and can skew the results. And that's dropped pretty significantly from last week. It's almost a full percentage point lower on that highest metric, which is pretty good. It means that we're doing enough tests and things are definitely trending downwards. And we have a lot of vaccines out there, and generally, once cases start to trend downwards, they can start to trend downwards pretty fast, as we saw during January and February. Looking at the 7-day average for the state, this is where we are right now. We are now actually slightly lower than we were at that dip in early March, that before we started trending back upwards again. So that is that's pretty good. We're still above 1,000 new cases per day on average, but we are the lowest we have been during this calendar year. When we look at it as the entire pandemic, of course, we've got a little artifact there from Christmas and New Year's where things were not really reported very much. You can see we are about where we were in late October. This is the last little drop off there. This is the last couple of data are incomplete. But so we still have a ways to go to get us back to that easy period we felt last summer and early fall. But we are moving in the right direction. This is also where we were, say, in just under a year ago, in mid-May, when things were starting to trend downwards after the first initial spike. So things are making progress. And with that, with one last thought. So this is probably going to be the last regular update for some time. May come back when there's news that needs to be reported on. And so I'm sure we're all excited about bars and ball pits reopening in the near future and getting back to life, and because things are going in the right direction in terms of case counts. And there's a lot of vaccines out there in the Commonwealth. So it can be pretty easy to think that this is basically over with. I just want to remind everyone we've been at this place multiple times before, and let's not let down our guard. We still want to have hope and optimism for the future, but it's also important to make sure that we don't let ourselves get complacent and backslide again, because we don't want to go through last fall again. Now, that's obviously a lot less likely to happen since we have the vaccine out there, but we still need to be on our guard. For more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.